Welcome back. Well, doctors say that our gut health could actually be the key to preventing serious diseases, and the best time to start is now. From liver disease to colon cancer, many GI conditions are preventable with the right steps and early action, which is exactly what we're talking about today. Joining us now, Dr. Hussein Wazaz from MidState Gastroenterology Specialist. He's going to share key warning signs, simple lifestyle tweaks, and smart ways to protect your digestive health before issues arise. Doctor, that's the most important part, right?
Yes.
Prevention.
Yes, Natasha, I like to tell my patient an ounce of prevention equal a pound of cure. I think the best time to see the doctor before the problem gets severe, and prevention is better than the treatment itself. So we're going to highlight 3 disease states. Number 1, the upper GI tract, which one of the most common symptoms patients complain about: upper GI discomfort, heartburn, nausea, and so forth, which could be transient and relate to certain food. I know we talked about Mexican food earlier.
That might do it for you.
How does that happen after a couple of tequilas? But if this problem become chronic or something the patient complain of it on a daily basis, then you need to see your gastroenterologist and check, make sure it's not a sign of something called erosive esophagitis, which is ulcer in the esophagus, which can lead to Barrett's and early esophageal cancer. So seeing the doctor before the problem becoming more severe allow you to diagnose, make the lifestyle modification, and get the right treatment to prevent serious disease in the future.
Okay, so and by chronic, you were saying something you're experiencing daily, every other day.
Every other day, and without a major triggers. I mean, we all know if you overdid it, you're gonna have a heartburn, but if this become daily or become limiting your lifestyle, or you have serious or warning sign like difficulty swallowing, blood in the stool, weight loss, and so forth, maybe you have something more serious, need to be investigated before the problem get more advanced.
Sure. So the 3 things that you say we should be getting screenings for, and you should be on top of these screenings. So of course those GI diseases, liver disease.
I think liver disease coming into the forefront, how is it affecting everybody. We know there is increase of obesity and diabetes, unfortunately, and that can cause manifesting in the liver with something called fatty liver, and now have a new diagnosis is called MASH, which has nothing to do with the TV show. It's called metabolic associated steatohepatitis, which means you have increased inflammation in the body, which we know is bad for you. If you have inflammation, you increase your risk of heart disease, cancer, or inflammatory condition, or like arthritis and so forth. So the liver is an important part. Most of the things go through the liver. We have non-invasive testing now to diagnose and see if your liver is beyond fatty, if it's inflamed or scarred. And actually we have a new treatment modality which reverses the process itself.
Well, that is great. And then, of course, colon cancer screening is very important as well.
Colon cancer screening has become something, unfortunately, there's more incidence in younger individuals, and we have to consider it in younger people. Now we screen people as early as 40, and even younger with a family history of colon cancer, or if you have inflammatory bowel disease like ulcerative colitis or Crohn's disease. And now there's a better advancement in our endoscopy center in Wallingford. We use from all these things something called GI Genius, which is artificial intelligence to allow to diagnose the early precancerous lesion and resect to prevent cancer from happening. I know we made stride in treatment cancer, and all this idea is to prevent cancer, prevent liver fibrosis, prevent cirrhosis, and prevent these diseases before it become more severe.
Yeah, important to know what you just told us about the screenings, what ages you should be starting. The sooner the better. Stay on top of that, and people can obviously come to your locations. Where are you located, doctor?
We have actually multiple locations all over the state. Our main office at the hospital, we do in Meriden at MidState. We have offices all the way from Woodbridge to Farmington and Newington. So we have office statewide. We have friendly staff, and we can see you in a timely manner for screening. And if you get sick, we can see you also in a timely manner. But the best time to see the doctor actually when you are not very ill, which the doctor can help you diagnose this disease and prevent it.
It's all very important. Doctor, thanks so much for the great prevention tips. If you guys would like to learn more, you can head to MidStateGastroCT.com. Don't go